Hello, everybody. Good morning, good afternoon, good evening, whenever you are at the moment. Welcome, everyone, and thank you to those joining us live and to those listening in afterwards. I would also like to warmly welcome our speakers and moderator today, whom I will shortly introduce in the webinar. This webinar is entitled as Digital Health in Pharmacy, FIP Online Course for Educators and Practitioners, organized by the FIP Academic Pharmacy Section and Technology Advisory Group, supported by FIP Provision Program. Next, please. Hello again. I am Dr. Nao Karakawa, Associate Professor at the School of Pharmacy, University of Nottingham, UK. I'm also Interim FIP Education Secretary and Global Lead for Competency Development in the FIP Hub. I'm honored to have led this FIP online course, the Digital Health in Pharmacy for Educators and Practitioners. So I'm going to moderate this webinar for you. Next, please. I'm also now pleased to be introducing our facilitator for today's webinar, Dr. Genuine Desir. Genuine is a FIP Educational Partnerships and Project Manager based in Kenya. Thank you, Genuine, to support and facilitate the session with me. Next, please. First of all, I need to inform you all about the housekeeping rules. This webinar is recorded and live streamed by YouTube, and also will be available at the FIP website afterwards. Please ask your questions by Q&A box in the Zoom, which will be answered by speakers during the session or at the end of this presentations, or will be answered live during the Q&A session at the end of the webinar. Please also provide your feedback by emailing to webinars@fip.org, as your feedback will help improving our webinars. Finally, if you find these FIP webinars helpful, please consider becoming a member of FIP at www.fip.org if you haven't been a member yet. Next, please. So today we will have great speakers, as you can see in the screen. All speakers will be introduced when they will speak in the session briefly. Next, please. So now you can see today's program in screen. So we will have remarks by FIP CEO Dr. Catherine Dagan first. Then you will hear from Mr. Jaime Acosta about the importance of digital health in pharmacy. Following that, Dr. Adi Mizrahi will talk about the importance of integration of digital health topics in pharmacy education. Then I will introduce some testimonials from previous participants of the FIP online course on digital health in pharmacy. Then Dr. Daria Vazis will present you a brief history of the course. Then finally, our module team leads will present updates in 2020 for course. After that, Dr. Genuine Desir will provide the launch announcement. Then we will finish our webinar with Q&A sessions, so please address your questions in the Q&A box. Next, please. So now I'm pleased to introduce the FIP CEO, Dr. Catherine Dagan, who provided recorded remarks for the launch of this FIP online course on digital health in pharmacy. Next, please. Thank you, Catherine.
I think we can hear the video, Genuine.
It seems there's some problem.
We might have to reshare.
Hello, everybody. My name is Catherine Dagan. I'm the Chief Executive Officer of the International Pharmaceutical Federation, FIP. Founded on the 25th of September 1912, FIP is a global organization for pharmacists, pharmaceutical scientists, and pharmacy educators globally. We are comprised of member organizations, individual members, academic institutional members, predominantly scientific member organizations, allied organizations, and those who observe us. We work in partnership with many organisations globally and have been in official relationship with the WHO since 1948 and have an official relationship with UNESCO, having the only profession-led Unitwin programme. It's very important for us to understand what drivers and barriers may stand in the way of progress of advancing pharmacy worldwide. And in this era of artificial intelligence, digital health is increasingly vital in pharmacy practice. Digital tools allow pharmacists to monitor patient adherence to medications, to help them manage their chronic conditions, their non-communicable diseases, also their infections, and provide personalised care plans. Digital tools facilitate better communication between pharmacists and patients, fostering stronger relationships and encouraging proactive health management. Digital health initiatives can also aid in tracking disease outbreaks, vaccination rates, and other public health metrics, allowing pharmacists to contribute to community health efforts and primary healthcare in its fundamental form. Incorporating digital health into our profession not only improves individual patient care, but is also there to enhance the overall effectiveness of the healthcare system. Hence, there is a huge need and imperative to have pharmacists well-skilled and competent in the digital world. We just had our 82nd Congress, Global Congress for Pharmacy and Pharmaceutical Sciences in Cape Town, where we emphasised the pharmacist roles in leveraging artificial intelligence, enhancing expertise and improving patient outcomes. In this third iteration of the FIP Digital Health in Pharmacy online course, FIP is doubling down on ensuring that pharmacists everywhere have the basic knowledge needed to take advantage of digital health tools, and that educators can incorporate digital health into their foundational pharmacy curriculum. So that not only are we supporting practitioners out in practice, but we're preparing the practitioners of the future. In this iteration of our Digital Health in Pharmacy online course, learning materials have been further updated to keep abreast with the evolving digital health environment and to be more useful to the learners. The course has been awarded the FIP seal, which recognises that it is of quality recognised by others. This will assure to others that they can avail of a course that has gone through the QA processes we would expect. FIP acknowledges the support of all of our officers and staff who have contributed greatly to the success of this course, and feedback will be gratefully received. As you can see, we are constantly iterating, building and developing this online course. We hope this course will be useful to all pharmacists, and we would nudge you to be part of the digital revolution in pharmacy and in healthcare. Please join us in availing of the course, in undertaking the course, and being part of the development of the digital revolution, and all of us standing shoulder to shoulder to advance pharmacy worldwide. Thank you so much.
Thank you, Catherine. So now I would like to introduce the next speaker, Mr. Jaime Acosta. He's a community pharmacist in Spain and immediate past secretary of FIP Community Pharmacy Section, and are currently co-chair of FIP Technology Advisory Group. Unfortunately, he cannot join us today, but he provided recordings of his talk about the importance of digital health in pharmacy. Can you please bring his talk?
Hello, everyone. My name is Jaime Acosta, Jamie, if you prefer. I'm a practicing community pharmacist from Madrid in Spain, and I am currently co-chairing the FIP Technology Advisory Group. First thing, I apologize for not being able to be with you live today in this very important launch event, as I would have wished to be because of our professional trip. Secondly, very importantly also, thank you for your attention. And third, last but not least, huge congratulations to all the members in the team for this new edition, which I'm sure will be a great success. And I know all the effort that you put in it. So congratulations and thank you as a pharmacist and as the Technology Advisory Group co-chair. So I'm talking today about the importance of digital health in pharmacy. Digital health is the field of knowledge and practice associated with the development and use of digital technologies to improve health. Technology and digital transformation, as you know, are rapidly changing information ecosystems and health systems design. The utilization of various digital technologies such as artificial intelligence and machine learning offers great opportunities for improved health services, access to healthcare, health workforce, and health outcomes. Today, everything is affected by the digital revolution. The impact of new technology on improving the health and well-being of individuals, communities, and populations is unprecedented, and it has only begun. We have not seen even a very small part of it. Recent technological achievements have revolutionized clinical practice from prevention through diagnosis, monitoring to disease management, and has enabled unprecedented public interest for a very good reason and engagement in self-management and well-being of people. Global health, this is cannot be discussed, has improved dramatically in recent decades. However, the current model for providing healthcare is being slowly torn apart by the opposing forces of global aging population and generally greater restraints on government and healthcare insurance companies' spending. Maintaining the status quo is not an option, also for pharmacy. Few industries have the potential to be changed so profoundly by digital technology as healthcare. Regulatory barriers, economic hurdles, and difficulties in effectively digitizing healthcare awaits those who wish to launch pioneering services. To deliver continued improvements to the world's healthcare will need to be transformed, with digital playing a vital role. The healthcare system of the future will look vastly different to what we have today, with a crucial change being the move to consumer-centric healthcare, allowing citizens to have much more responsibility for managing their healthcare and that of their families. A truly digital healthcare industry would revolutionize diagnosis and treatment with a shift, and this is very important for the profession, with a shift in focus to prevention and management, especially through the use of artificial intelligence and big data. Nowadays, the most noticeable changes for citizens is becoming more engaged to manage their own health and care. Through self-care and monitoring of vital signs, and individual's health can be continuously tracked now today. If needed, a virtual care consultation, also by pharmacists, can be arranged so that citizens can receive advice and healthcare input without leaving their homes. Digital health is crucial for pharmacy as it enhances patient care, medication management, and healthcare more efficiently, making it essential for pharmacy students and the practitioners of today and the future to be proficient in and lead the digital transformation to optimize healthcare outcomes even more. I wish the student of this digital health in pharmacy online course for educators and practitioners a successful and enjoyable learning experience. Thank you very much. Enjoy the digital course.
Thank you, Jaime. So now I'm honored to introduce Dr. Adi Misori for next talk about the importance and the integration of digital health topics in pharmacy education. Adi is a pharmacist, data scientist, and researcher in Australia. He's also a member of FIP Technology Advisory Group. Thank you, Adi, for joining us today. The floor is yours, Adi.
Thank you. Thank you for that introduction. And I want to share that same sentiment that Jaime and Catherine mentioned about digital health and how it's become an essential part of our modern healthcare. It's transforming how we provide and manage and sort of optimize our patients' care. And so as part of that, the integration of digital health topics in the pharmacy curriculum is crucial for preparing students to thrive in this changing landscape. So as pharmacists, we are expected to leverage the digital tools, data, and health technologies to improve patient outcomes. Our roles are changing and our education needs to change with it. So in the next slide, we traditionally saw that pharmacy education focused primarily on, the dispensing of medications and compounding. However, we started seeing in the late 20th century that the role of the pharmacist began to shift, and it became towards a more patient-centered approach. And this required a new educational elements. So this pharmaceutical care, which emphasized the importance of pharmacists, not just as dispensers, but as healthcare providers, actively involved in that patient care and medication management. So in this response to this shift that happened, pharmacy curricula worldwide, many of you may have noticed this as well, began incorporating clinical training, communication skills, and patient-centered care practices. So this kind of shift in behavior response shows that the history of how pharmacy education has adapted to meet the changing demands of healthcare. So now there's this rise of digital health and technology in pharmacy. So the past decade, for example, we've seen digital health, has necessitated a new set of competencies for pharmacists. Some of you may remember the COVID-19 pandemic. It accelerated the adoption of telepharmacy, a lot of digital patient records, and even mobile health applications. Pharmacy education now needs to include this digital literacy to ensure that pharmacists are ready to use these digital tools such as health records to be able to support telehealth consultations and also engage with patients through these digital platforms. Many schools have started offering courses in health informatics, digital health, and telepharmacy practices to align themselves with this evolving role of pharmacists. A lot of these places have utilized digital tools as well to actually enhance education. I know a story of some programs introducing virtual reality, and they use VR simulations in a game time form for students to help them practice telehealth consultations. And this is reflecting on how digital tools are also transforming pharmacy education. With the advancement of personalized medicines, we're seeing pharmacists are increasingly required to interpret complex patient data. In the future, we would probably see more and more of this genetic information coming in and using this information to start optimizing medication therapy. Education in this area is now growing for some pharmacy programs and schools. In the last slide, the next slide, I want to say, considering where we are, digital health integration in pharmacy education allows future pharmacists to provide more patient-centered care. For example, the mention of electronic health records, their use can help improve medication reconciliation, prevent errors, and ensure better follow-up. Telepharmacy services can extend care to remote areas, increasing accessibility and equity in healthcare. I want to finish up by finally saying that integrating the digital health in the pharmacy curriculum is not just about adopting new technologies. We're not here just to sit there and use a mobile phone. It is about building a future-ready workforce. As digital health solutions continue to evolve, pharmacists must be agile learners. We have to have this continuous state of learning and therefore be capable of adapting new tools and practices. By embedding digital health within the pharmacy curriculum, we are taking now a proactive approach to ensure our pharmacists can meet future healthcare challenges and therefore drive the innovation in patient care. I'm going to pass it back to you, Naoko. And if anybody has any thing they want to reach out for at any point, I'm more than happy for them to get in touch with me. And thank you guys for being here and having me.
Thank you, Adi. So I think unfortunately he won't be able to stay in the webinar all the time. So if any question to Adi, please address in the Q&A box, and as we can actually send a question to the Adi later. Thank you, Adi, for a great contribution. Next, please. So now I think the audience and the participants of this webinar, I understand the importance of digital health in our pharmacy practice and the future of our pharmacy practice, but also for patients and the public, and also the importance of us learning digital health so that we can teach digital health in pharmacy education as they prepare our graduates and as the practitioners to prepare for this digital health in their practice. So we got the testimonials from the previous participants of this course, so that's probably you actually know what's coming in this course and if you actually participated. So now I'd like to introduce some testimonials from previous participants of the course. First one is Dr. Kevin Yap. He's from Singapore, and he stated that this course was a very insightful course, especially for those who are just starting out in designing or developing digital health courses for pharmacy students and practitioners. I'm also happy to know that Kevin found that the practical components that was the most useful, and considering his future designing digital health training for his own pharmacist. Thank you very much, Kevin, for your testimonial for this course. So next slide, please. So another testimonial we received from was Dr. Chinwe Eze from Nigeria. She was glad that she acquired an in-depth knowledge about digital health tools through this online course concerning future of healthcare delivery at her healthcare facility. We learned from these testimonials and feedback from previous participants for our updates of this FIP online course on especially fast-changing topic, digital health. So next, please. So now I'd like to introduce Dr. Dario Bazis, who is an FIP Senior Program Lead, and will talk about the brief history of the course. Over to you, Dario.
Thank you so much, Nako, and welcome to everyone that's with us today on the call, but also for all of our colleagues listening in afterwards. I'm delighted to be with you all today to launch the 2024 iteration of the FIP course on digital health. But I would like to emphasize on Adi's last point about the importance of having an agile and well-equipped pharmaceutical workforce in digital health. That it's not just about utilizing digital health tools, it's really more about how these tools can empower our patients and our consumers to optimize their health outcomes. This is precisely why we are here today and why we have developed this course. And my 5-minute presentation is just to give you a bit of a historical background that brings us to this launch, but also to provide you with an overview of the on the FIP development goals. Thanks, gentlemen. Thank you. So let me begin by highlighting the FIP development goals for those of you that might not have heard of them before. These were launched in 2020. These goals serve as a vital resource for driving and advancing the transformation of the pharmacy profession at global, regional, and national levels. They align with FIP's mission to support global health by enabling the advancement of pharmaceutical practice, sciences, education, and workforce. They are really set to transform pharmacy in alignment with wider global imperatives, underpinning the UN Sustainable Development Goals, the SDGs. So having a set of ONEFIP development goals is imperative to bring science, practice, education, and workforce together in one transformative framework for our members and the wider profession to clearly set out the goals for development for the years to come. You can see on the screen that we have a dedicated development goal on digital health, that's DG20. DG20 emphasizes the importance of digital transformation within the pharmacy workforce and having effective processes to facilitate the development of a digitally literate, equipped pharmaceutical workforce, which is what Adi and my previous colleagues have explained or described. The DG20 also stresses the need for systems and structures in place to be put in place to develop and deliver quality digital health and the pharmaceutical care services associated with it through the digital literacy and utilization of technology and digital enablers to widen access and equity, and to also underscore the application of digital technology in healthcare delivery and the development of innovative medical products. So as such, and along with the 20 other development goals at FIP, FIP is set to transform global pharmacy, working in partnership and in collaboration with our members and our colleagues everywhere. I invite you to visit our website to learn more about the FIP development goals that really underpin a lot of the work that we do. Next slide, please. Thank you. So in 2021, FIP published a groundbreaking report titled Digital Health in Pharmacy Education. This report presented findings from a global survey on digital health in pharmacy education, with contributions from over 1,000 academics, practitioners, and students across 91 countries. The report highlighted the readiness, the adaptability, the responsiveness of the pharmacy education sector in addressing digital health. It outlined some of the knowledge and the skills needed by the pharmaceutical workforce in this area, as well as educational initiatives from pharmacy schools around the world. And it also provided evidence base for integrating digital health into pharmacy education. So ultimately, the findings from this report really emphasize the importance of developing change makers who can drive the integration of digital health and the expansion of teaching capacity and capability in this crucial field. In response to these insights, in 2022, FIP's Academic Pharmacy section and the FIP Technology Advisory Group, formerly known as the Technology Forum, launched the first iteration of the Digital Health in Pharmacy Education course. Now, feedback retrieved from the course developers and the participants in the course revealed that there was a need to expand on the content to accommodate various scopes of practice as well. So by 2023, the first of the original 3 modules were redeveloped to more directly benefit practitioners. Participants now also have the option to complete 2 additional modules that focus on integrating digital health into pharmacy curricula. Now this year, in 2024, we've built on these improvements. Learning materials have been updated once again, with a particular focus on enhancing the usefulness of Module 1. These updates reflect our commitment at FIP and our colleagues alongside us to continually refine the course to meet the evolving needs of educators and practitioners in digital health. And this reflects what the previous presenters have already explained in terms of the speed at which digital health has been evolving in the field. So finally, I would like to mention that the course has been developed by FIP and meets the criteria of the FIP seal for quality. Thank you so much for the opportunity to provide these remarks. And I would like to invite the module team leads to provide a brief overview of the updates in the latest iteration. And now I will hand over to our colleague, Dr. Michael Katz. Thank you so much. Now over to you, Michael.
Thank you, Dalia, and good morning, good afternoon, good evening to all of you. And it's really great to see so many of you from all over the world joining us today. Greetings from the western part of the United States, where it's still very early in the morning. So thanks for helping me wake up and to try to stay awake. Before I go on, I want to recognize the leadership of FIP that are with us today. Naoko, Dalia, Genuine, and many others. And I think it's really a credit to FIP to see how much they're supporting this effort in the area of digital health. So as Dahlia said, I'm Michael Cates. I'm a professor at the University of Arizona College of Pharmacy in the United States. And one of my roles at our college is to work with our international programs. Next slide, please. As was mentioned by Dahlia, the digital health program has been divided into several modules. I was honored to be the lead of Module 1, but I really want to recognize my Module 1 team. It was truly a pleasure to work with them, and I want to recognize Profs. Mohammed, Tora, Mohammed from UAE, Tora from Sweden, Natasha from Serbia, and Whitley also from the US. And one of the most gratifying things about working with FIP is being able to work with such intelligent, motivated people from many different countries. So again, thanks to them for all of their hard work. Next slide, please. So Module 1 is serving as an introduction to digital health. And as was mentioned a moment ago, those of you who just want to get maybe a taste of digital health or dip your virtual toe in the water, you can complete Module 1 as a standalone module. But I think we're really hoping that if you're not sure about digital health and you go through Module 1, that you'll become excited and want to delve into Modules 2 and 3. Module 1 has been divided, as you see, into three sections, three major sections. And basically what we did is we did lots of research and selected specific readings that will help you be introduced to digital health and help augment your knowledge and understanding. And each section has required readings that have to be completed to move on in the program, but also has optional readings. We do have a fourth section that is completely optional for those of you who want to delve in more depth and more detail in specific topics. Then there are additional readings there. Section 1, you can see the objectives on the slide, and this is to understand the trends and role of digital health technologies in healthcare in general, but also in pharmacy practice. And it's hopefully will answer some questions. As you see on the screen, what is digital health for those of you that are really new to the field, and what are some of those key technologies? We, of course, want to discuss what is the current status of digital health, but we know that this landscape is changing incredibly quickly. So we're trying to think of not only the here and now, but what may be happening in as far as future developments that will impact our healthcare system, us as clinicians, but of course for our patients as well. And recognizing, of course, that all of you are from different countries. FIP is a global organization. We want to think globally and think about how digital health is being planned and implemented globally and in your specific country. Next slide, please. Section 2 delves in more detail into specific digital tools for pharmacists. And you can see the list of some of those digital tools, and I'm sure some of those you recognize: health information systems, care delivery platforms, mobile health applications, wearables, and other remote patient monitoring, whether it's our step counters that we wear around our wrist or continuous glucose monitoring technology. I'm sure many of you are familiar with those. Clinical digital support, of course, and AI, as we all know, is everywhere, and it's being embedded in so many different things. And I know there was a question in the Q&A that will be addressed later about integrating AI or how we handle AI in the educational environment. And of course, for us as pharmacists, digital therapeutics is also very important. Next slide, please. Section 3 is talking about challenges with digital health, and I'm sure all of you understand that there are many challenges. So the objective, as you see, is to develop an understanding of what some of these challenges are. And we've divided it, as you see, into three subcategories. The first, looking at the big challenges or grand challenges, things like patient safety. With new technology, there's always concerns about safety. Cybersecurity, with information being exchanged in the cloud, being stored in different places. We're all very concerned and sensitive about the need for security. Like everything we do in healthcare, interdisciplinary collaboration is so important, and that is certainly true in digital health. How we're going to implement digital health, how we're going to evaluate it and make sure that we're assuring the quality. Interoperability, we're all dealing with this in our daily practice lives, and we're using many different systems, whether it's electronic health records or other systems, pharmacy systems. And at least in the United States, we have lots of problems with interoperability and systems not being able to communicate and to exchange information. And then finally, ethics and governance. How will these challenges be addressed? And specifically, how will they be addressed in your country? Next slide, please. As I mentioned, section 4 is completely optional. For those of you who want to delve in more detail about all of these topics or individual topics, you're more than welcome to do that, whether it's AI or digital therapeutics, educational topics, pharmacy practice topics. You're more than welcome to delve into those. And again, these are strictly optional. These do not have to be completed to successfully complete the course. Next slide, please. So with that, I would like to turn the floor over to Prof. Aoke.
Thank you so much, Michael. So it's my pleasure to present to you what Module 2 is about and also how we have updated this module. I'm involved both in the academic pharmacy section as well as in the technology advisory group. So this course is really at the heart of both, and I'm very happy to have been able to contribute to this module. Next slide, please. I would also like to acknowledge the Module 2 team. So when we started this course, it was, apart from myself, Dr. Naoka Arakawa, you've met her before today, and also Nilhan Usman. She was very instrumental to this module. She was working at FIP at the time, but she just left FIP and was not involved in this update anymore. But we are very happy to acknowledge her contributions to the first version. And we are very thankful to Tora that she not only joined Module 2, but also Module 1, as Michael Katz just said, but also the Module 2 team. Next slide, please. So Module 2 is really about how you can integrate digital health education in your own curriculum. So I think moving from Module 1 to Modules 2 and 3, the focus becomes on education and how in curricula, in other places, we can actually teach students, teach colleagues about digital health and its applications. So I think that Module 2 has not been that much changed as compared to the Module 1. Module 1 is about technology itself, and that is where I think innovations are going very fast. So probably from year to year, we need to have a critical look at Module 1. We also, of course, looked critically at Module 2, but our learners already appreciated Module 2, and so as a transition also from Module 1 to Module 3, and that is why we had no major updates on the objectives. We still maintained the case studies, and also the assignment remained unchanged. Maybe shortly about the assignment, because it's also about what this module is about. This module is about integrating digital health education in your own curriculum, and it requires you to have a look at your own health systems and what are the desired competencies that are needed in that health systems, where are the priorities, what is the institutional setting that you are dealing with, but because depending on your own environment, your own context, some next steps might work out and some are more difficult to take, and bringing the health systems and the competencies needed, and therefore also the learning objectives that you want to achieve if you develop a digital health education with the institutional settings. That is what this module is very much about. So also thinking then about the enablers and the challenges that you may encounter is part of the assignment. So the minor update was that we had a new recording of the introduction to the module, and also, for example, and I think that is very important, a new slide referring to the FIP competency-based education implementation handbook, because I think when thinking about digital health education, taking the perspective from competency-based education, we want to, of course, people need to acquire knowledge, but in the end, it's much more important that they have the competencies to integrate digital health in pharmacy practice when they are practitioners themselves. And I think that's also why this referral to the handbook is very important. This is my contribution about the Module 2 update, and I'm very happy to now give the floor to my colleague Barry Blythe about Module 3.
Thank you very much. My name is Barry Blythe, and I'm an adjunct professor at Florida A&M College of Pharmacy and Pharmaceutical Sciences Institute of Public Health in Tallahassee, Florida. And next slide, please. And I just wanted to acknowledge two of my hardworking, dedicated people who were very much involved in creating Module 3 in terms of Manzi Doshi and Professor Lillian as a party from Malta and India, respectively. And we've worked at that. And we made a few minor changes. Next slide. It's about how to develop digital health in your curriculum. Okay. And it's much more detailed than just technology. Okay. Digital health creates a new type of anxiety in your patients and in your students. So we need to learn to recognize that. It's an added layer of complexity. People are just learning things for the first time about safeguarding not only your private information, but having proper backup systems, learning about different types of search, especially now with artificial intelligence, you know, what's accurate, what's valid, what's, you know, good for you. Attributing proper credit, a very big part of this, because it also includes, if you use AI, you should give credit. Matter of fact, ethically, you should let people know that you've gotten some of your information from that. So it works that way. And then helping people comprehend their digital footprint. What have they left behind? So that's not just for your students or your patients, but also for you. And then, of course, common courtesy. Okay, being respectful and doing that. So this is all about digital literacy, being that. And then we have that's what we've built on that. And then the next slide, please. We updated our learning activity. So we're asking you to perform a self-assessment of an application in digital health that you've done in your practice, or that practice is in, you know, pharmacy practice or in academia. And then to describe the position or role of the peer whom you're going to be working with for this. You're going to provide details of some type of strategic or action plan or training tool or experience that you're planning. And then we're asking you to reflect and report. And we've done all this in a pass-fail. It's not, you know, you're not going to be graded, just that did you follow all the steps? And I guess the key thing coming out of Module 3 that we wanted people to remember is the human touch. Digital health is very important, but we are dealing with humans, whether they're our students or our patients. We need to really look at remembering the human and doing that. So that concludes my update of Module 3. I'll pass it on now back to Naoko.
I think now I would like to introduce Dr. Genuine Desir to talk about the actual enrollment process. Genuine, over to you.
Thank you very much, Naoko, and thanks, Barry, and all the other presenters for the great presentations. As already shared with you, my name is Genuine Desir, and I am privileged to support this great faculty in managing this course and managing our online learning platform. And at this juncture, my job is to now share with you some very important information about the course content and about registration to the course. So to begin with, this course is a self-paced, on-demand course that is hosted on our online learning platform. That's the FIP online learning platform that we call FIPX. And this means that you as a participant have the flexibility to set your learning pace based on your individual learning goals. And of course, this is very much in line with adult learning principles. So the course is an exclusive benefit for FIP members, and FIP members get to access the course for free. So we encourage those of you who would like to access this great learning content to join FIP, become FIP members. And you can easily do so by just scanning the QR code that's on the left of your screen. Also to mention that registration for this course opens today, and I'll shortly share with you how you can express your interest to join the course. The course will be open in November 2024, and participants will have till May of 2025 to complete the course. As has already been mentioned before, the course is composed of 3 modules, with Module 1 earning you a foundational level certificate, and Module 2 and 3 earning you an advanced level certificate. Module 1 is split into 4 sections, as already outlined, and as participants, you will need approximately 4.5 hours to complete Module 1. I just like to also point out that the figures that you're seeing, this time estimates, are actually very conservative estimates, and they assume that as a participant, you do not take any breaks in between modules or any of the sections. And of course, depending on your pace and your learning goals, you may take more time or less time as you proceed through this module. Participants can also choose to take the advanced level of the course, and that is modules 2 and 3, as you can see on your screen. For module 2, participants will require approximately 3.5 hours to complete it. That is minus the assignment and peer review. And for module 3, participants will need another approximately 2 hours to complete. So in total, that's about 5.5 hours for module 2 and 3 without the assignment and the peer review. As I had already mentioned in my previous slide, that these figures are conservative estimates, and depending on your learning speed and your learning goals, you may be able to take less time or more time, but this is just to inform you of some of the time requirements that will be required of you if you decide to join the course. Another thing that I'd also like to share is that this year we have introduced participant feedback forms after each module. And so we are requesting that, and we do encourage that you share any module-specific feedback that you may have, as this supports continuous improvements to the course, as has already been mentioned. Finally, I'd like to share with you how to register your interest for the course, and I can assure you that it's simple, and here's how to go about it. First, begin by scanning the QR code that is on the left side of your screen, and this QR code will take you to the registration page on the FIP website. Once you're there, you fill the registration form and click the submit button at the bottom of the page. Please note, while you're on this registration form, that some of the fields will already be pre-filled for you based on your existing membership data. So some of the fields will be grayed out and will have data with them already. So do not be worried about that. After you've filled and submitted this form, of course, we will receive your registration, and thereafter your login credentials will be shared with you via the email that you registered with once the course is open in November. Once you get your credentials, you're able to log in onto the FIPEX learning platform, and you'll be able to start and complete the course at your own pace. I'll just pause here for a second to allow those of you who would like to scan the QR code to do so in about 2 or 3 seconds. And so with that, I'd like to thank you all for your attentiveness throughout the launch event. And I do look forward to all of you joining and benefiting from this online course. I'll now hand it back to Naoko for the Q&A session. Thank you.
Thank you, Genuine, and thank you all speakers for your presentation. Now, all of the speakers and facilitator, please turn on your camera, and thank you for stopping and sharing the slides and to see all faces of the presenters. So now, dear audience and the participants of this webinar, so this is the time for the Q&A session. So, Daria, is there any questions we have in the Q&A box, please?
Yep, we have a couple of really good questions. Actually, all of them are fantastic from all of our colleagues, so I think we'll go through them. Whilst we don't have Adi with us, but I was wondering, Naoko, if we could ask our panelists to comment on this question. How much are practitioner pharmacists, or how should the practitioner pharmacists be engaged in data science? I think they are talking about just how much the pharmacist practitioners should be engaged in data science, in your opinion. That is one question. And the other one that could be also related to it is, how can educators maximize the use of AI for learning without adversely affecting the creativity of students? So perhaps we can go around the room. Screen.
Yeah. I think that is 2 questions. I think mostly these questions came during the Adi's presentation, but I would like to ask some of the presenters to answer some of these questions too. So probably, can I start from Akir, asking about how much the practitioner pharmacists should be engaged in data science? What do you think?
Yeah, thank you for the questions indeed. And I guess it's probably also context specific, but more in general, I think that, I mean, to really get into the nitty-gritty of data science, we might also need people with different backgrounds, data scientists with computational science, etc. And maybe this might even be a specialization postgraduate for pharmacists. But I think that also practicing pharmacists will encounter at least, let's say, the outcomes of such exercises, so that you should at least know what data science is, how to handle big data, how to interpret maybe some of the results. And that is, at least as an educator, what I see as one of the things that we should do in education is familiarize future pharmacists with, let's say, the possibilities, but also the impossibilities of data science, to avoid that people think this is too difficult for me, this is not my piece of cake, and leave it up to others who might not know the pharmacy practice, the patients, etc., as much as pharmacists do. So I definitely think that it's not all on us, but we need to play a role.
Definitely. Any others like to contribute to it?
Yes, I will. In this country, in the United States, many hospitals are asking the pharmacist and the pharmacy departments to measure their contribution to the patient outcome. Okay, so you have to really have a handle on the data within your institution. So that's one place where practicing pharmacists have to have a handle on data information. And then if you're working in the community, there's also community health, the public health. There's data that you can generate or that you will have access to that can help you in your practice. So I'm thinking pharmacists really need to be data scientists now. It's just moving that direction all over the world.
Yeah, thank you, Barry. Mike, do you have any comments on that?
About that specific question, no, but I was hoping we could address Dr. Robles's question about AI in education.
Yeah, so that second question, so how can educators maximize the use of AI for learning without adversely affecting creativity of the students? So Mike.
Yeah, well, I mean, I think that the correct answer is we have no idea, but I'll try to make up something. But no, I mean, to be more serious, I mean, those of us in education, we're really struggling with this, and I think, you know, when, for instance, generative AI technology like ChatGPT came out, I think our first reaction was we have to ban it, we have to prohibit students from using it, and maybe about 5 seconds later, we realized that's not possible. You know, basically, at least the strategy we're taking, I think in general, is trying to encourage students to first understand it, but then use it. And I think Barry mentioned this earlier, you know, use it as a tool. Just like, you know, we use other informational tools to help us take care of patients, to use it as a tool and also reference it if it's being used as a tool. I think the challenge, though, is that the technology is changing so quickly. And, you know, just in the year and a half that ChatGPT has been available, you know, even that technology has changed really, really quickly. And there's so many AI platforms that are really great tools. You know, but, you know, so we certainly want to allow students to use those tools to enhance their creativity, as Yolanda was talking about. But also, you know, we are concerned about academic integrity and cheating, and, you know, those tools, you know, certainly could be used for nefarious reasons. So again, in academia, we're still struggling to figure out how to balance that.
Yeah, thank you, Mike. I think I agree. You know, probably we don't know yet how we're gonna do that. But from my side, I also you know, believe that the students and the graduate and the practitioners should be able to embrace these AI, but also critically evaluate all the information they created. So I think these are something that, you know, the education have to move forward strongly. Akia, you want to actually add something for it?
Yeah. I wanted to add, and I think you partly said it, that it also taps on our own creativity as educators. So what kind of assignments do we give our students to help them understand how they can use it, but also, let's say, the impossibility. So as a small example, I've heard of a colleague who asked a clinical question to a generative AI software, got 3 answers, and then asked the students to reflect on those 3 different answers that were generated to the same clinical question, like where are the similarities, what might be the source, where are differences, what does this mean, so that they get aware that whenever you ask a question to something like ChatGPT, that you always need to critically think. So yeah, so we have a role there as well, I think, and need to be creative ourselves.
Definitely. Barry, you want to contribute to it?
Yes, because I agree with both speakers. Creativity's always been a strength of our students. Okay, so they were going to use it. They're going to find that there's many ways for us to get engaged with it. That's why, as I said in module 3, we talk about attributing credit to, hey, yes, we use it, but here's what we've had to add to it, and also the ethical and the accuracy of the data and that kind of stuff that you might use. So it's not a problem. I mean, using it, it's how you use it and how do you document that you've used it right now. That's where we're working on.
Yeah, thank you, Barry. I think I'm conscious about the time, but we see the great questions coming in. So I think I hope the speakers are available for next 10 minutes and the audience. If you cannot stay, then we will keep this recording, and then you will see in the FIP website later. So Daria, is there any interesting questions?
all questions are interesting and very useful. A very quick one that we can answer from one of our colleagues is the course only for hospital pharmacists, or is it also useful for community pharmacists? And we can answer that very quickly, that it is for all practitioners, correct, Narco and team, in any sector? Correct? Lovely.
Yes.
So I hope that's helpful for you, Nida. We have another question from our colleague Paul Fahy, who is asking, is there a specific module section of the course on fundamentals of data and data competency and management? This is often not taught uniformly at undergraduate level and is becoming ever more important, as otherwise it will not be possible to take advantage of the power of machine learning and artificial intelligence. Wondering if any of our colleagues would like to make any comments on this. Thank you.
Thank you, Daria. I think if any modules can cover, I think that is the module 1. Mike, is there any part do you think we cover that?
I don't think in the depth that the question is asking. I mean, certainly some of the readings will touch upon that, but not in that kind of depth now.
And that could be something that we could definitely note for our next perhaps update. So I'm happy to put a note on this. Really good comments.
I think that's a good idea, Dalia.
Yeah, we'll do that.
Thank you very much for the questions and the feedback already for the next update. So another question, do you think
yeah, we can maybe do 2 more. We can probably provide some comments for our colleagues from LMICs who are asking, what is the importance of digital health for developing countries, do you think? Example, Sri Lanka. Comments from around the room, and perhaps we could take one more question, and that's coming from our colleague Ron, who's asking, does the course have an assessment of how much digital health technology is available in the jurisdiction or country where the pharmacist practices? I'm also happy to take note of this for our next update as well. Thank you.
Thank you. Anyone who would like to contribute first?
Maybe I can, Naoko, and especially the second question, but it also relates to the first indeed, is that in the module 2, educators are encouraged to indeed think what is necessary or what are the most pressing steps, most urgent priorities in terms of competency development in their local setting. That can be a national setting, that might be even a regional setting, because if, for example, augmented reality is not something that is doable within your setting or the most pressing thing, why should you teach it in your environment? So, but I think that, for example, also in low and middle income countries, many people have access to internet. So medicine's information, how are you going to deal with using of generative AI, for example, is probably something that is important to consider. I guess there's low middle income countries that are introducing also maybe support systems for decision making. So if that's the case, you should probably think about it. Maybe it's not a chatbot, but there's other virtual things how you can interact with patients. So if that becomes the case as a community pharmacy, is this something that you want to offer? If so, in what way? How does it fit within your treatment plan, for example? So even if you don't have the most advanced technologies, I think technology is everywhere, and this is very important. So I really welcome the 2 comments, because it shows that the critical thing is thinking, discussing within your communities, what do we need to teach our students? What competencies do our pharmacists need at this point in time?
Thank you, Atkia, definitely. Anybody else who wants to contribute in these 2 questions?
Yeah, Noko, I can add something. And I think, the importance is certainly equal in developing countries, if not more important, and particularly in resource-challenged countries that are very rural. It can be very, very difficult to gain information, to be able to connect with your patients. So I think each country has to look at what technologies are readily available and build those platforms. For instance, many people can't afford to buy an expensive Apple Watch, but almost everybody in the world has access to a mobile phone. And so building mobile health platforms and using mobile phone technology, is a way to engage patients really in any part of your country.
Definitely.
Yeah, I was just going to agree, Mike. I think it is maybe more important in the developing world because they have access to things now that they might not have had access to, and when everything data was physical in terms of books and library access, and now it's much information is much more accessible by people from all over the world. So I think it's actually more important.
Yeah, definitely. I think adding to the all comments from all speakers today, I think we can use our knowledge learned from this online course can be the tool for your advocation to the policymakers, which digital health would be the best for your local settings. Then probably you can talk about how this can impact on your patients' health outcomes. I think that would be quite helpful to improve your patient outcomes, and you can plan how to educate the pharmacy practitioners for that too. So Daria, I'm kind of becoming more and more conscious about the time. Is there any questions that should we address in the session?
I think that we've done quite well. One quick one we can maybe comment on is the course relevant to a non-pharmacist? So could we say that if you are in the health field, if you're also an educator related to the health field, that it would be useful for you to try out the course, and we do invite you to explore it. So that's my comment on that question.
It is digital health,
Barry?
not pharma. Yeah, it's
Exactly.
digital health. Yeah, not pharmacy health. So
Beautiful.
it definitely would be applicable.
Thank you so much.
And I think particularly module 1 is really not pharmacy specific. So I think that would be especially attractive to non-pharmacists.
Definitely.
Thank you for highlighting that. That's fantastic. Really wonderful. And apart from that, I think that we've done quite well. Sorry that we can't take a couple more questions, but I'll try and answer them very quickly now in writing to support those colleagues.
Thank you, Daria. So you will see the answers in the writing in the Q&A session, Q&A box actually. So thank you very much for all speakers. Now I would like to hand over to Genuine to actually complete the webinar. Thank you, everybody.
Sorry, I was speaking on mute. Thank you very much for the great questions from all our participants, and we do hope that the event has been impactful and beneficial to you. We really do look forward to you being part of the digital health revolution, as mentioned by our CEO, Dr. Catherine Duggan. Also, thank you to all our speakers today for your very informative presentations, and again, very succinct responses to the questions that have been asked. And I think your input and your contributions to this work have been amazing. So as we close out, we'd like to remind all of you to check and register for future digital events by visiting events.fip.org. That is events.fip.org, as you can see on your screen. We always have great digital events focusing on specific areas of pharmacy practice, and you can register for any that you're interested in. With that, I am sincerely grateful for all of you who have joined us today, and we wish you all a good rest of day. Thanks, and bye for now. Thank you.
Congratulations, everyone. Well done. Thank you so much.
Thanks, everybody.